And the third thing we want to be practicing is classic pelvic floor exercises to build strength and tone in our pelvic floor muscles. We need our muscles to feel strong and under our control so that we feel supported and closed and toned inside, so that we can interact with our partner during sex, and so that we will have stronger orgasms that will be more pleasurable for us. And obviously, because those muscles are so important for our bladder and bowel control as well. So there are two types of exercise that you should practice.
Okay.
They're called the quick ones and the slow ones.
Keep it simple.
We keep it simple, and that's just what everybody calls them now. The quick ones are short on and off squeezes, not held for very long.
Okay.
These we need in everyday life if we're going to cough or sneeze. And they're like when you go to the gym and you lift a weight and then you bring it down, and you lift a weight and bring it down. They build up the muscle to be a strong muscle. And then the second type, which we call the slow ones, are a slightly less strong hold, but you need to be able to breathe at the same time and keep that hold going for at least 10 seconds. And that's your endurance fibers that you're engaging with and encouraging to grow. And in everyday life, we actually probably need that skill more because it's how we stop ourselves rushing to the toilet.
Yeah.
It means we'll have more comfort for longer during sex. We'll be able to stay engaged and not get tired and feel sore.
Lovely.
So
how do we do it?
We do them very straightforward. We'll start with sitting ones. Later we might do some standing. First of all, sit square on your chair. And you want to rock till you can feel your bottom bones. And that will keep your pelvic floor muscles a little bit lighter underneath you.
Okay.
Yeah. And first start with something that you've done all your life. Tighten and release the back passage as if you were stopping wind. It's usually the least bruised from delivery. And most people have got a memory of how they used to do that. So imagine you're having tea with someone very important, terrible wind. What would you do to stop? Just squeeze and let go.
Great.
Yeah?
Got it.
And it's just an on and an off, as if you're trying to close that hole, release it.
And when you say quick, how quick?
Yeah, so on, off.
Okay.
On, off. Not do, 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 do.
Not nippy.
Not nippy. Somebody once said, not like a goat eating grass. No. And as well as closing in, there is a little bit then lift as well.
Yeah.
So think of it like lift doors closing and then the lift going up.
Okay.
And then release. And you've probably done about 5 at the back now.
Yeah.
So now move your attention forward. Think about the opening of the vagina, where the bladder would empty. And now try and lift and tuck the vagina up inside and then let it drop down. Or you might think of closing as if you're stopping a wee and then releasing. But something a little bit more forward, nearer the bone underneath. And do one more, a close and lift feeling, and then a drop and open.
Okay.
And this is what we mean by quick. It's not that quick. And it doesn't have to be 100%. A good 60 to 80% of what you could do will make the muscle grow.
Okay.
But you should feel it's more than, you have to make a bit of effort.
Yeah.
Otherwise the muscle won't grow.
Okay.
And total, we do 10 of those.
Okay.
I like to do 5 at the back and 5 at the front.
Okay.
But when you get a bit better at it, it's both things together.
Yeah.
The back and the front working as a pair. And then let go.
And it's a good idea, isn't it, if you're working both the back and the front, almost to start at the front and sort of bring the pressure forward.
Yes, it kind of depends what works best for you.
Okay.
Some people like to start at the back and bring it forward. Other people feel they're better at the front and get the front right and then add the back.
Nice.
So, and eventually it becomes one thing.
Yeah. Okay.
But it is actually partly slightly different fibers and you can favour one over the other.
And is it also possible to favour one side over the other as well?
So the sides are a bit like your cheeks.
Yeah.
They pull in from the edges.
Yeah.
Can you pull in one cheek? You can sort of pull in one without the other, but quite difficult not to do them both together.
Okay.
So a little bit more advanced would be to think of a back a front and some sides.
Yeah.
And then let go. But if you're just starting out, finding back and front is a really good classic place to start.
Perfect.
One little thing extra is that you must let go. So it's not just about the up, it's about the let go as well. Because of everything we've talked about so far today, it's the releasing and coming back to zero and letting blood flow that is such an important part of our healing.
And so often not talked about. When we talk about pelvic floor exercises, don't know about you guys, but when I got taught them or when they were mentioned by my midwife or doctors, it's all about the lift and the squeeze and tightening, and actually the release is just as, if not more important, as we've discussed.
Yeah, and if you went to the gym and you had a hand weight, people doing that, you know that's not right. You've got to come right down and right up. So make sure you come all the way up and all the way down.
Yeah.
It takes a little bit longer, but it's a better experience for the muscles and covers everything they're going to need to do in real life.
And it gives you mobility and flexibility in the muscle, doesn't it? Rather than it bulking up tension without any functionality.
Yeah, exactly.
Which is really important in the pelvic floor, let alone for your biceps. So
And then the second exercise is called the slow ones. And this is where we're going to try and hold that muscle contraction, maybe about half what you could do. But the real skill is you've got to be able to breathe at the same time.
What about talking?
Talking would be more advanced. I don't particularly like counting to 10 because that just encourages you to hold your breath.
Interesting.
So I'm going to suggest you try 3 breaths as your starting point. So we're going to say relax your muscles completely. It can be quite nice to take a breath in. As you breathe out, draw your muscles up underneath about 50%, and then try to breathe normally over the top. And again. And again. And then consciously let your muscles go. And sometimes you don't know whether you did it till you let go.
Yeah.
And some people won't even be able to manage 3 breaths at the beginning. They'll just do one, tighten up one breath and let go. But your goal is 5 breaths, which is about 10 seconds. So if we do one that's 5 breaths, it would be take a breath in to get ready. As you breathe out, close the back passage and the vagina and the bladder tube openings and lift them towards your ears and hold and breathe. And breathe. And breathe. Keep it going. Top it up if it's fading. And then let go.
I managed it.
Yeah, well done. And 10 seconds done properly is quite long.
Yeah.
So it tends to get a bit skimped. And the gold standard is to do 10 repetitions of 10 seconds, but that's the goal. That's where you're trying to get to. You might need to start with 3 repetitions of 3 breaths. And each day or every couple of days, be pleased when you think, oh, I just held that a little bit longer. Or I did another extra one on the end. That's how you'll see yourself progressing and know that you're improving your skill set.
And I always think as well, if you know, even a little bit is worth doing.
Definitely.
Because quite often I sort of think to myself, oh, I haven't got time for that. So, you know, I'll miss it and I won't do them. But actually, even if I've only got time for one, it's better than nothing.
1 pelvic floor squeeze is better than no pelvic floor squeezes. But I'd like to encourage you to do a few.
Yes.
Or it will take a really long time for your muscles to grow.
But don't give up because you can't do, you know, you can't set aside a whole 15 minutes for it. Or something like that.
In fact, if you do your 10 on and offs and maybe 10 holding for 5 seconds, you're actually only looking at about 2 minutes. And for mums, really good to think about combining it with feeds. Because you can't really get on with too much else when you're nursing. Or car journeys where you're the passenger, maybe not when you're the driver, when you're the passenger.
That is advanced.
Children's bath time. It's another time where you've got to be present, but maybe you're present, but what could you be doing while they're in the bath? And also that lovely cuddle time at bedtime where you're settling children and maybe you're hovering in the room or you're nearby. It's slightly dead time. Use it as the opportunity to do your pelvic floor exercises. And then you get them done as part of looking
daily
after the
life.
children,
Yeah.
rather than thinking of it as something you've got to do separate. Make it part of your routine.
Yeah. Great. Thanks very much.
Pleasure.